Welcome to the Government News Brief for Friday, November 25, 2016. In the news, Guyana joins with the rest of the world in the fight to stamp out gender-based violence. The Public Health Ministry is encouraging Guyanese to get free eye surgeries, and 8 to 5 students graduate from the Youth Entrepreneurial Skills Training YEST program. Stay tuned for these and other stories. Thank you for staying with us. I am Renetta Lafleur, and now for the details. In observance of the International Day for the Elimination of Violence Against Women, Guyana today joined with the rest of the world in the fight to stamp out gender-based violence. Details in this report.
Speaking at an interfaith service and roundtable discussion, Minister of Social Protection, Vala Lawrence, issued a plea for Guyanese to break the silence and speak out against acts of violence.
I want us all to break the silence, to lend all our voices throughout all the regions of this beloved country of ours. But not just to lend our voices, I want us to do so in unison against domestic and intimate violence. To become involved and demonstrate our commitment to the elimination of this social ill, which is so rife in our society. Did you read the papers this morning? Today, I want us all to make it our business, make it our responsibility to shatter the glass and speak out loudly and strongly against the high incidence of violence that prevails in our villages and communities.
The ministry has several activities planned for its 16th day of activism to end gender-based violence. A week-long radio program, an art gallery, school outreach programs, and a self-defense workshop are among the activities. Director of Social Services, Wentworth Tanner, explains.
In 2016, we plan to ensure that we have an activity in each of the 10 administrative regions. We're working closely with the regional democratic councils in most of those regions, but where we don't have those collaborations, we are working through the regional women's affairs committees, which are going to be soon renamed to regional gender affairs committees.
The impact of violence against women should not be underestimated as it affects every man, every woman, and every child, according to Abiki Benjamin Samuels, Deputy Director of Social Services.
Gender-based violence knows no geographical, cultural, social, economic, or educational boundaries. Violence against women and girls is a terrible reality that affects the lives of millions worldwide. Guyana is no exception. Putting an end to these violations is a moral obligation for which purpose we should all unite. Every man, every woman, every child.
The local theme for ending gender-based violence is Orange the World, promoting equality, ending gender-based violence. I am Zanil Williams for the Government News Brief.
Guyanese diagnosed with visual impairment are being urged to take advantage of the free eye surgeries offered locally. Delicia Haynes has the details.
Minister of Public Health Dr. George Norton emphasizes that free eye surgeries offered to Guyanese must be considered a privilege, noting that in other countries there is a cost attached.
We take things for granted. In the small islands in the Caribbean, every cataract surgery that is done, they have to pay 400 EC dollars. In Bascom Palma in Miami, to do a phacoemulsification with intraocular lens implantation, foldable lens and so on, minimum 3,000 US dollars. If any one of you here have cataracts, Dr. Hines will take you down to the Georgetown Public Hospital, and with a little bit of adjustment, she can have your surgery done Monday morning or even later today at no cost to you.
The minister was at the time highlighting the need for diabetic screening and early detection of visual impairment in persons diagnosed. Diabetic retinopathy has been recognized as one of the more serious states of diabetic eye disease and is the leading cause of blindness.
I am pleased to see that diabetic retinopathy program is already well established at the Georgetown Public Hospital Corporation, and that was launched in June of 2016 with the objective to screen 16,000 patients living with diabetes, of which 10% of that amount will have to undergo treatment for diabetic retinopathy.
The diabetic retinopathy program is working towards continued screening by making the process for diagnosis easier, thereby having patients know their status with relation to diabetes and how it affects the eyes. Ophthalmologist at the Georgetown Public Hospital, Dr. Celeste Hines, says that the program for detecting diabetic retinopathy is being improved.
The World Diabetes Foundation has helped us to procure some very expensive retinal cameras and other ophthalmological instruments, which will now help us to fast track the screening process. So instead of having to go through a long eye exam with your ophthalmologist, you come, you get an appointment, you get dilated, you get examined.
Diabetic retinopathy is preventable, but there must be early detection and treatment. In ensuring that a person does not develop diabetes, there is an urgent need for a healthy lifestyle to be practiced while managing health through constant visits to the doctors. For the Government News Brief, I am Delicia Haynes.
85 graduate from the Youth Entrepreneurial Skills Training YEST program at the Sophia Training Center. More in this report from Neola Damon.
The Sophia Training Center's 29th Youth Entrepreneurial Skills Training Program began on May 16, 2016 with 105 trainees. The program today ended with the awarding of certificates to the 85 graduates, 61 males and 44 females, who despite challenges persuaded their training to the end. The youths received their certificate at the graduation ceremony held at the Carifesta Sports Complex. Minister within the Ministry of Education, Nicolette Henry, who graced the ceremony, commended the youths for successfully completing their training.
Your performance is worthy of note, especially since 105 students started, but only 85 of you made it to the end. So you need to give yourself a round of applause. I'm sure that the 6 months you spent attending classes here were very challenging, but your perseverance has borne fruits. You are now skilled in the areas to which you were exposed, and I encourage you to develop those skills to the fullest.
The 85 persons successfully completing a 6-month training in one of the 6 areas: catering, office administration and information technology, refrigeration and AC, welding and fabrication, masonry, and plumbing and sheet metal. A number of private and public sector agencies accommodated the graduates for 6 weeks of work-study attachment. Most of the agencies have since offered permanent attachment to the students, a fact Minister Henry credits to the training the graduates would have received under the program.
This is an indication that what is taught here and the performance of the students during their attachment are a credit to this training center. And I would like to urge you to continue to be good ambassadors of this center.
Now that the graduates have been empowered, Minister Henry urged them to further develop their skills for the betterment of themselves and their communities.
Become an active participant in developing yourselves and your communities. You are now in a position to contribute meaningfully towards the development of your communities and not to depend on what your community can do for you.
Best graduating trainee were Casey Crawford in the catering program, Rafi Kalfi in the office administration and information technology program, Ryan Suku in the refrigeration and AC program, Leslyn Williams in the welding and fabrication program, Jamal Griffith in the masonry program, and Roger Limerick in the plumbing and sheet metal program. I'm Neola Damon for Government News Brief.
As Guyana celebrates foster care in the month of November, the Social Services Ministry plans to implement a new program to further encourage persons to foster a child. Details in this report.
The ministry's foster care manager, Colleen Khan, points out that this new program will provide persons with more information on the foster care process and how it works.
We're also looking at having a mentorship program. It's kind of an extension of foster care, but instead of you bringing the child home to live with you and your family, you can dedicate an hour a week or a few days a month to being like this role model in a child's life, particularly adolescents.
Khan says that although the department has been placing and reintegrating children into foster care, there are still many children who are not placed because persons would rather adopt.
Currently, we have just under 200 children in foster care with about 109 foster parents, so that would suggest that there are foster parents who are caring for more than one child. We would like to have more children placed, definitely. Currently, we have over 600 children in children's homes across the country, and many of them are eligible for foster care, and they range from birth, from infants, babies, to 17, 18 years old.
Khan notes that the challenge is that many persons are not properly informed on the process. Khan explains that foster care is just a temporary care option for a child and not permanent.
It's not adoption where you permanently care for the child. So we have foster care placement periods that can be a few weeks. We may just need you for a weekend. A child has been abandoned. We need to place that child into care. So you could be very short term, or you can be long term. It could be a 6-month placement, sometimes 1 year.
Meanwhile, the department for this year has conducted several outreaches and sensitization programs on foster care at parent-teacher meetings in several primary schools and other institutions. For the Government News Brief, I'm Gabriela Patram.
More women are now making a name for themselves in the mining sector. Several of them are undertaking a geological survey in Region 7 to map mineral deposits. More in this Paul McAdam report.
The Geology and Mines Commission's Geological Survey Unit is undertaking a mineral survey in the Itabali area. A University of Ghana scholar, now a chemical geologist, Nkechi McPherson, started at the GGMC in 2011.
The field experience has been good. It's a lot of hard work, so you should be active before you get in the field, or else you'll really feel the pressure. This is the first trip where I led a team on my own, so you have to be confident in yourself, and you have to understand that not everything that you see on the map is what will be on ground, so you have to cater for all of those uncertainties.
Another female is geologist Thais Frather, who started her stint in 2009 at the GTMC.
It is a challenge, but I like it. It challenges your mind and your body at the same time. When you're out there, you have to think about the dangers, but at the same time, you have to keep pushing yourself.
For Tricia Tullock, this is her first trip into the fields.
It's been quite interesting, and I like it a lot. I didn't expect to like it, but I do. I really do. And it's good. You get to experience new things and realize that you're not fit sometimes, that you need to exercise. But otherwise, it's very, you learn a lot. You learn a lot about your country.
Senior geologist Unata De Freitas has already served more than 19 years with the GGMC.
You can see definitely that the females are finding it a workable and a suitable environment to work in. There's a lot of experience that is gained, but more so what is given back to our country, because we have a passion for the natural patrimony, and we understand that the more information we get, the better position our country is in.
Getting a first-hand look at the project was Minister within the Ministry of Natural Resources, Simona Blooms. She describes herself as a living evidence of what women can achieve in the sector.
People say, oh, she's a miner, she's a pork knocker. But now I'm a minister, and tells you that the sky is the limit. I would want to encourage women to get involved. We are more tidy. We can make a difference in these areas, and I really admire the geologists, and Unata spoke about the passion. So when we come to do things, we want to do it in a particular way. We're looking for that result. The division, the opportunity here is real.
The 8-week Regional Geological Sampling Project began on October 13 and is due to be completed by December 8. Some $40 million has been budgeted for the project. Paul McAdam for the Government News Brief.
Today is International Day for Elimination of Violence Against Women. The day is being observed under the theme, Orange the World, Promoting Equality, Ending Gender-Based Violence. Violence against women is a human rights violation and the consequence of discrimination against women in law and also in practice, and of persisting inequalities between men and women. It also impacts on and impedes progress in many areas, including poverty eradication, combating HIV/AIDS, and peace and security. Violence against women is not inevitable, but prevention is possible and essential. It calls for intensive work with collective efforts. Gina encourages you to break the silence of domestic violence and save our young girls and women from gender-based violence. This has been our Friday, November 25, 2016 edition of the Government News Brief. The details of these and other stories can be found on Gina's website. We encourage you to subscribe to our website and YouTube channel. You can also like and follow us on Facebook to be updated as the news unfolds. Remember to join on Monday for another edition of the Government News Brief. I am Renetta LaFleur. Do have a safe weekend.